Hey guys, I thought I was done posting for the day, but I guess I'm not. I'm really feeling the struggles of one of my mom friends on TikTok. Her TikTok name is Autism Mom, and I'm just feeling for her because she struggles with her child eating at preschool. So I just thought, as a speech and language pathologist who is also a feeding therapist, and I have been a feeding therapist for a lot of children with sensory processing delays, a lot of autistic children who have sensory processing delays, and just certain preferences, very strict preferences about what they feel comfortable eating, putting in their mouth. So if maybe just a little bit of education would be helpful, so to just the world. There are children who are not autistic that have sensory processing delays and sensitivities to foods tactile, so the way foods feel in their hands, in their mouths. Also sensitivities to smell. So like they may have a very adverse sensitivity to the smell of oatmeal or anything. A lot of the children that I have done feeding therapy with who are autistic, most of the ones that I have seen as a feeding therapist, it doesn't mean all autistic children have these sensitivities, but most of the autistic children that I have done feeding therapy with have very intense sensitivities to smells of food, to the look of food, to the touch, the way the food feels in their mouth, in their hand. And they have had only a few things that they would eat. Even I've had kids who are autistic that are 5 years old and they will not eat food. They are still drinking Pediasure from a bottle because their parents have tried and tried and tried, even with feeding therapy with other specialists. And it's not easy. I have a son, and he does not have sensory issues with food. And as a mom packing his lunch for preschool, I still worry about, am I putting the right things in for him to eat, that he will eat? And sometimes he doesn't eat everything. Sometimes, it just depends. Now imagine being a parent of an autistic child with sensitivities to eating, or a child who may not even be autistic but has sensory processing delays and sensitivities with or sensory stuff with food. And you have to think about what to pack for your child in their lunch that they will actually eat when they go to school. And it's very hard. And on top of maybe they only eat certain foods because they can only tolerate certain foods because the other ones are, they're sensory, they're too defensive sensory, whether it's smell, tactile, look. Imagine trying to pack a lunch for your child if those are issues. Then on top of that, 6% of autistic children have rituals around eating, not even just sensitivity. So now we're talking about rituals around eating. So I've had autistic children in feeding therapy whose parents have told me that the foods that they eat at home, they won't eat in other places. Or I also had, I remember specifically one mother that told me her autistic child could only feel comfortable eating on a plate from home. So she had to send the plate in every day to school so that he would eat something. She also tried putting things in little baggies for him to open and he would not eat if the food was in bags before it went on the plate. These are the things that some of our parents with autistic children are, I don't want to say dealing with, but dealing with. It's not think bad about the child, but imagine if you are a child who had sensory processing issues and you just don't, for whatever reason, it's too overwhelming. Smells for me are 10 times more intense for them. Touch is 10 times more intense for some kids. You know, these are things that these poor children are also dealing with, and they need to eat. We need to eat, especially if we're going to school. We need to be able to eat and feed their brains. These brains are developing, especially in preschool, and it is just not easy. And it is definitely not easy for parents either. So we need to all have a little bit of grace, and we as professionals need to educate more, I think. And so this is why I'm making this video. I'm just gonna give you 2 more statistics, and then I'm gonna leave you guys alone. If you go to the website Autism Speaks, okay, they have each called Parents Guide to Feeding Autistic Children. Statistics. Researchers found that 69% of autistic children are unwilling to try new foods. They don't feel comfortable, they don't feel safe. It's too, the tactile, the sensory stuff is too overwhelming maybe. 46% of children on top of that, autistic children, have rituals around eating, and I described some of them. There's a whole document on this, and it's for a reason. So we need to just be sensitive to our parents who have autistic children, and sensitive to our children, these autistic children that we serve, that have these needs, and that they have to deal with, the children have to deal with this. We are lucky, we are blessed, and we need to be sensitive to that. So if a mom is packing a lunchbox with specific foods for an autistic child, we need to stop as providers, as educators, as people that are there, for these children, as professionals and educators. We need to stop and think, what did that mom have to do? How did she feel when she was packing that lunch? She knows that there are only certain things that her child will eat. And so this is probably very stressful. And for this particular mother, I know she has worked so hard with feeding therapy and all kinds of therapies to get her child to even eat healthy foods. A lot of children with sensory issues around food will not even touch what we want our children to eat, healthy foods. It's not feel good for them. And so as parents, to any parents, we always try to get our children to eat healthy food, and it's not always easy. And for a child with sensory needs, sensory issues around feeding, it's even harder for that parent. If a child with an autistic child is now eating in a new environment that is different than what he or she is used to, on top of that, is going to be difficult for them. Maybe they were used to eating in an environment that was more quiet, or it had different people in it, different seats, anything different is going to be more challenging. So please, we need to try to help these parents and their children as best that we can. All right.